Hi, it's Jessica DaMassa with HIMS TV, and joining me right now I have Robyn Symon. She is the producer and director of the film Do No Harm, which was shown last night here at Health 2.0.
So movie night.
It was a movie night. So talk a little bit about the film for those who are not familiar with it. What is it about?
Well, Do No Harm exposes the hidden epidemic of physician suicide. Doctors, take an oath to do no harm, to save lives, but they're taking their own. They're dying by suicide at an alarming rate, almost twice the rate of the general population. And they have the highest rate of suicide among all professions, but yet no one's talking about it.
Right.
So this film exposes that, getting people talking.
It's definitely done a lot of that, and I know, physician burnout is something that I think, has entered the conversation quite a bit over the last couple of years, but taking, I think, to this next step and really addressing physician suicide is something brand new. So how is the film received here? We were talking a little bit earlier, and you had mentioned you've shown it a lot to other physicians and medical school audiences, but this is your first health tech audience.
Yes.
So what was different?
So we launched the international film tour in September for Suicide Awareness Month, and the tour is mostly medical schools, hospitals, and conferences. But yes, this is the first tech health conference. So it's curious to me to see the relationship between technology and physicians, because one argument is that medicine has become too much of a business and too impersonal. It's become an assembly line practice, which is not why doctors got into medicine in the first place, not to be businessmen. So while at the same time I think it's great if there is innovation to help the doctor's life become more streamlined or more efficient, I worry that at the same time we don't want to lose that personal connection.
Sure.
So the tech is great if it helps physicians, the workflow, if it allows doctors to work at the top of their license, but at the same time, we really can't lose that personal interaction that is the reason why doctors get into it, and it's the reason why patients love their doctors.
Right. So tell me a little bit, I guess, this is something, it seems like, that you've developed in terms of, working on the film. It's a takeaway for you. It's like, oh, what's the role of technology? It's a question that's come up for it. What are some of the other things that you hope people start to wonder, I guess, or the food for thought that people are exploring as a result of watching the film?
Well, people are just shocked to learn that doctors have such a high rate of suicide, and the burnout rate is over 50% in some specialties. So just the dialogue alone, and to have a film that pulls back the curtain on the problems, the systemic problems such as sleep deprivation, and even earlier in med school, the bullying that goes on, this cutthroat competition, the assembly line care, that really sets off these young doctors on a path that's not healthy. So they come into medical school healthier than the general population, and by the time they're in their residency and practicing, they have the highest rate of suicide among all professions. So what's going
happening?
on?
Right.
That's what the film looks at.
And you've listed a couple of things that I think that you've pointed to: assembly line care, sleep deprivation, things like that. Is there anything else that might surprise us in terms of a factor in I guess, help in what's perpetuating that problem among physicians, especially even after they leave medical school and they're out practicing? Is there anything else that kind of came up in the film?
Yeah, what's interesting is that what's happening is there are these internal and external pressures that doctors are facing. So the internal pressures are the stigma. These are doctors who, have been getting gold stars since they were in kindergarten.
Yeah.
So the internal pressure of, let's say, struggling to cope is devastating for them. Mm-hmm. At the same time, they're dealing with these external pressures, such as managed care, fighting with insurance companies, that they have no control over, but yet they're forced to deal with. So what was most interesting to me is you've got the less autonomy, more pressure, lots of debt still from medical school, and this is like a perfect storm.
It is.
And you can't get help. On top of everything else, when you're a doctor, you can't seek help because if you're sued, your medical records health records, mental health records will be subpoenaed. And when you go to relicense, there's a question on most states on the licensing board exam. Have you ever sought treatment for a mental illness, which includes depression? So you either lie or you go miles and miles outside of your area and pay cash, maybe use a different name. Why should that be? So part of the charge that we have with the film is to change that question so doctors don't feel like they have to lie or hide, because the stigma is tremendous. Doctors are healers. They're not supposed to be human, but they are. And it's harder than ever to be a doctor. So if you can't get help, like for losing a patient, what do you do with this grief? Well, you self-medicate, or you become very isolated, depressed, disillusioned, and in many cases, you take your life because you feel so trapped in a system that you've really lost the joy to practice in.
If you were to say, I guess, one piece of advice, or if there's one thing that we could do to help these physicians, what do you think that would be? Like, to the greater healthcare industry, I mean, what could we do to provide the support or reduce the stigma for them getting help? I mean, what would your advice be?
Well, part of it is the regulations that we have to address, and just by talking about it in hospitals, in medical schools, they're now doing like wellness programs and things like that, but it's really talking about doctors as humans that is the first step. And they have to know that they're not the only one. See, physicians feel like there's something wrong with them. They're not measuring up. So what they have to understand is that it's not them. Everyone is feeling this way from medical school on. And in fact, when people see the film and they see the medical school section, they say, oh my God, I've repressed how traumatic my med school experience was.
Wow.
The bullying, the pimping, which is put in my place. You know, you're publicly humiliated by your attending physicians. They have repressed all this. They've repressed the trauma of seeing death all the time and being told to move on. Mm-hmm. Don't talk about it. Even when there's a suicide in their institution, it's hidden, which is what the film also covers. So there is change underway, and they're not alone.
Well, it's amazing that you're bringing visibility to this, and I'd like to help support the film by getting more visibility for it. And so, how do people watch this? I see you said you're doing your film festival tour.
Yeah.
But what are you doing? How can you watch?
It's a strategic release. So we're doing an international film tour of just medical schools, hospitals, and conferences like this, because I really want to encourage a panel discussion and Q&A. So it allows everyone to talk about what's happening in our institution and what needs to change. So these panel discussions are critical in opening the dialogue. So that's the first step. The next step is public television. We've been approached by public television for a broadcast deal where we'll be able to actually have sponsors. So I'm here talking to some interesting people about sponsoring a broadcast, because they allow you to have a minute before and a minute at the end of the show. So broadcast is also, and eventually we'll have educational kits for hospitals and medical schools with a DVD and a discussion guide. So that's in the works. And the DVD will have different lengths of the film, so they can, plan it in their curriculum. And then eventually it'll be available on Amazon and for download. But that will be like next fall 2019 at the earliest. But I really, as the producer and director, I really want to see if I've hit all the core issues. And I'm learning so much on this film tour.
Well, that's fantastic. Yeah. Well, best of luck to you with
Thank
it.
you.
Again, the film is called Do No Harm, and you can look for it at a conference near you sometime soon.
Medical school, or you can come to our website.
There you go, and take a look. Good.
DoNoHarmFilm.com. where we have a screenings tab if you want to request a screening
fantastic.
at your hospital or med school or conference. There's a screening tab. You just fill it out, and someone from my team will get back to you.
Great. Well, thank you so much for joining us. It's a pleasure to learn about the film. Best of luck with it.
Thank you.
I'm Jessica DaMassa for HIMSS TV at Health 2.0. Thanks for joining us.